committee meetings more recently. This was developed by a policy organization called Policy Research Associates some years ago as a way to think about our justice system and the different points along that system where there are real opportunities for diversion and alternatives to custody, particularly for those with mental health and or substance use disorders. So this sort of lays out the different points, they call them intercepts, along the way where there are opportunities for us as a county to change the way that we're doing things. And our mission, as you all know, is to really expand and increase opportunities for very early diversion away from the justice system and toward our health agencies and other treatment and appropriate resources, and increase also along the way for folks who are involved more deeply in the justice system and in the courts, increase opportunities for alternatives to jail custody. Because we're really looking at getting folks out of custody, moving them into treatment and services. And our motto has been, that was stated by the board in the motion, treatment first and jail last. So the Intercept model traditionally starts here with Intercept 0, talking about community services. And this is where, if there's folks who are experiencing a crisis, what are the opportunities, the options that exist in the community where we do not, that we can call upon and access instead of connecting to our justice system. So this is where you'd be talking about, some of our recommendations refer to the Department of Mental Health access line as an alternative. You know, instead of calling 911, there's another place to call if there's a behavioral health crisis, and other things like that we'll get into. Intercept 1 is after there has been contact made with law enforcement, usually after there has been a call to 911, what opportunities exist to change that process. Intercept 2 is usually once you're talking about initial detention, so this is post-arrest, so this is, law enforcement has been called, they've responded, there has been a determination to make an arrest, and then there's some decisions that are made about whether to book someone into custody, whether that's at a local police lockup. Some people refer to them as city jails, sheriff substations. Folks can be booked directly into county jail, but often they're booked into the more local lockup first. Then they move, if someone is kept in custody, then they move into the court process. So you're talking about arraignment and first appearances in front of the court. So that's really where we're getting into moving after that into Intercept 3, where you're talking about folks who are now mostly in county jail custody and in front of the court for the whole court process. Intercept 4 typically refers to reentry. What are the opportunities, what can we do there? Thinking about folks returning back home, back to their communities. And Intercept 5 refers typically to community corrections, so folks who are under probation or parole supervision in the community. So I'm going to turn it over to Diana now, but you will see that we have added an intercept here, and we're calling it -1.
Which precedes even Intercept 0, right? So it's before Intercept 0.
Yes, so the reason why we did this was because, can you go back to the other one? As you can see, kind of in Intercept 0, it starts at the point of crisis. We know that there should be resources at the point of crisis, but we added the -1 because we believe, and a lot of the recommendations actually were funneled under this piece, that there has to be resources to prevent crisis. So resources that folks can actually connect to before a crisis even happens and to prevent that crisis from happening. So that's why we actually created this Intercept -1 piece. We've called it a decentralized, holistic, community-based system of care. It kind of speaks to a lot of the recommendations that the community-based system of care has created. One of the core pieces of those recommendations has been focused on a decentralized model of care so that everyone in LA County has access to care before crisis and to prevent crisis again. So the way that we did this was we categorized the recommendations based on categories that were already in the interim report. So you can see up here the restorative behavioral health and primary care villages. Those particular recommendations really speak to actual physical infrastructure of these care villages that can provide both behavioral health support. We talk about kind of psychiatric urgent care centers in this piece, sobering centers, so the actual kind of hubs that need to be created to actually support people to access these resources. The other piece right here is a mental health, substance use, and co-occurring piece. So a lot of these recommendations spoke to those particular populations. It talked a lot about building partnerships between SAFC and DMH for residential co-occurring disorders services, and really also talked about conservatorship processes as well. And you'll see conservatorship processes are actually throughout the entire Intercept, because a lot of the recommendations spoke to that folks should have access to conservatorship processes across the roadmap. We also have a restorative justice section. So you can see it's a little bit bare. There was only one restorative justice recommendation, but we felt like that kind of deserved its own kind of area. And so there is that one piece in this document. And then the other piece is the Families and Support Network. There were a lot of recommendations that spoke to incentivizing families to actually follow their care plans, incentivizing families that are providing housing for their loved ones. So we kind of placed all of those in a particular bucket so that we could actually build out that piece for this decentralized system of care. And then you can see all the housing recommendations. So we shared this with a few folks already, but this is a long list of all of the different housing options that need to be scaled up and or created in order to speak to the needs of folks that are houseless, have mental health needs, SUD needs, or co-occurring needs. And then finally over here in the -1 section, we have the education, economic, and employment piece. So this is expanding employment opportunities for folks that have been impacted by the system, establishing partnerships with other employment programs, and also we also added here a recommendation that spoke to a flexible funding pool to support people with their economic needs as we prevent them from going into incarceration or support them during diversion or an alternative option. And so that then brings us to Intercept 0. So again, Intercept 0 is where this kind of crisis happens, and we definitely want somebody to have access to additional services to prevent them from going into incarceration. So you can see we created a few different buckets based on the recommendations that you all developed as a part of this process. Right here, I'll just start off with right here, the behavioral health team responses. So these are all the recommendations that speak to connecting people to the DMH PMR teams. Also connecting people to a non-crisis mobile response team to address the gaps. We talk about outreach workers to respond to non-law enforcement calls. So this is really at the point of crisis. How do we involve peers? How do we involve outreach workers and other types of health professionals to actually meet the crisis instead of moving them into the incarceration system? You can also see that, again, we have this kind of conservatorship process here, and it's also connected to the behavioral health team responses. For the crisis line, we talk about utilizing the DMH access line. We've also talked about utilizing the DPH SAFC line to actually leverage those particular call lines so that they can refer folks to these behavioral health teams when this health crisis happens. And then there's another section on 911, so training 911 operators to kind of address behavioral health issues through connecting them to health resources and modifying those kind of processes. And then finally, at the bottom, you can see kind of the public education campaign and the community health education. Obviously, these two go hand in hand. We really need to, some of the recommendations really spoke to providing this educational material to kind of the larger community, the public, and to community health workers, 911 operators, and to really build relationships so people know that there's another option when a crisis actually happens.
And one thing I'd like to just say is that you'll notice that there are numbers here right next to each other, each of these recommendations. What are those numbers? What do they refer to? Just think for the new folks that are here.
Sure. So the numbers you can see, like this one has 18, 22, 23, 24. Obviously, there's over 100 recommendations. So what we did was we numbered all of the recommendations and we began to place those recommendations into the ATI Intercept roadmap. If there was kind of redundancy, if we saw that these recommendations actually kind of fit together, we actually placed them together and reworded them utilizing all of the recommendation language that was actually created by the ad hoc committees, and developed kind of one core recommendation that speaks to all of these recommendations. So if you all have looked at the table that I sent out yesterday, you would be able to use that as kind of a key and see that this particular recommendation speaks to Rec 18, 22, 23, and 24, okay?
And those recommendations may have been developed by different ad hoc groups, but they were talking about the same thing. So this allows us to combine them.
And then so one more thing, you'll see that kind of the process that an individual will go through is kind of placed in this blue color. But during every intercept, you'll also notice that in the gray color, there's this community-based system of care piece. So what we're trying to show there is that at any point of the intercept, people should be redirected to the community-based system of care decentralized approach to access alternatives and diversion kind of services, okay? So you'll see that in all of the kind of slides we'll be sharing.
And I just wanted to add really quickly too that in the table it lists out all of the recommendations, but if you refer back to the interim report, and everyone should have a link to that, you'll see that the committees worked really, really hard to develop full analyses around all of these recommendations. So that's partly the reason why the report is so long, is that it includes the specific issue, and then a full analysis, and then recommendations that address that issue.
Here's the report in case you don't know, but there's a link, right? So it's pretty long.
Right. So these, you're seeing here an edited version, of much longer and more comprehensive information. So if you have questions about any of it as we go through this process, I'd really strongly encourage you to sit down, with a good amount of time with that interim report and make sure that you go through that full analysis so that you understand where these are coming from.
So as we transition over to you, Karen, let me emphasize again, so if you're new to this process, make sure that we get your email so we can send you the link, so that as you go into the next stage of the work groups, we really need you to make sure you read all this information, because there are a lot of folks that spent a lot of time doing this. So we really need you to do that so that you can help us keep moving the process forward. And again, we're here to make sure that if you have any questions, we can work with you individually to make sure you're not going to miss a step. So, Karen.
Thank you. Move on to. Thank you. So this one, there's not much on here. This Intercept 1, law enforcement. And that is because our fantastic mental health, behavioral health, and law enforcement small group within the Justice System Reform Committee spent a lot of time developing recommendations to prevent the call to law enforcement in the first place, right? That there's more appropriate responses to folks who are experiencing behavioral health crisis.
Over here.
And right, it goes back to 0. So on Intercept 1, you'll see things here about training for crisis intervention team training for law enforcement officers. A lot of it's happening already, but really making sure that all officers in every police department in the county are trained, making sure that we increase the co-responder teams. So those are the teams that are combination of police officers and mental health clinicians who go out together. Again, making sure that that's happening throughout the county, not just in particular policing agencies. There are decisions that are made here about arrest, about citation and release, about booking, and again, really emphasizing the handoff and the opportunities there to connect folks to community-based behavioral health responses rather than connecting folks more deeply into the justice system.
Keep going.
There's questions.
Can I ask, maybe if you can hold your questions, write them down so when we're done, we'll come back. Is that okay? So make sure you're writing your questions so you don't forget them. We'll go faster now.
Okay, so Intercept 2, this is really where we're talking about post-arrest. And you will see here, again, there are a lot of recommendations around the early diversion. So when we talk about diversion, depending where you work, if you work within the justice system, you know that often folks are referring to diversion after there have been charges filed and you're deeper along the line. There are a lot of recommendations in the report about pre-booking and even if you are booked, doing very early diversion out of local police lockups and city jails. There are recommendations here about expanding citation and release policies, around developing a robust system of pretrial release and services. There are recommendations too about making sure that prosecuting agencies have the information they need to make informed decisions about folks who may be experiencing behavioral health crises and have particular needs, and making sure that that information influences sometimes those decisions about filing. And then we move into first court appearance, which pushes us into the next Intercept, Intercept 3. And here, many of you are probably aware that there has been some recent legislation and new policies in place to provide for early diversion within the court system. And there are a lot of recommendations here around expanding those policies, making sure that they're happening consistently throughout the county at every courthouse, not just at a few of them. Making sure that we have enough support, so enough folks who are experts in behavioral health services, that the court and all of the stakeholders involved are aware of what the capacity is in the community to propose alternatives here, particularly around residential programs. So a lot of programs that have a bed component, and if we could have some kind of real-time database that shows what that availability is at all times, and making sure that everyone involved in the process really understands and knows what those options are. There are some recommendations here as well that speak to folks who are in jail, making sure that they get some additional services, particularly things around medication-assisted treatment, MAT programs, so that folks are in a better place when they are going back home and going back to the community, being connected with appropriate services. And here we have Intercepts 4 and 5. The focus within this group was really on reentry, and there was a lot of discussion around release planning from the jail. So folks who are coming out during the night, how do we address those issues? There are recommendations about setting up temporary shelters run by community-based organizations that are close to the jail, connecting to family members to make sure that they know that their loved ones are coming out and may need to be picked up. Also expanding the capacity of service providers to work during those hours and to be able to pick folks up and transfer them directly into residential programs. And I'm going to turn it back over to Diana to talk about infrastructure, and there's a lot of stuff here. But I just wanted to mention, too, that while it looks like, the Intercept model is laid out in a linear format, so it looks like you start from point A and you go all the way through to point X or Y, but it really, I think we need to think about it more as a cycle, that along the way that there are all of these different points where folks can connect back to the beginning, right? Back to the community-based services, back to what we're calling -1. And so we should just think of it, that there are always opportunities to do that along the way, and you'll see in the recommendations that that's really what they speak to.
So, the infrastructure piece, there were a lot of recommendations that spoke to like the foundational pieces that need to be created in order for everything else to function. So that's what we called infrastructure. For infrastructure, you'll see there is kind of a service coordination and communication section. This is pretty much talking about integrating and coordinating services, ensuring public and private partnerships. The main thing here, I would also say, is creating an alternatives to incarceration coordination initiative to continue, so that they can continue to monitor the implementation of the roadmap. And also think about equitable distribution of resources and service connection. So that's kind of what the service coordination and communication piece talks about. We also added an equitable resource distribution section. Obviously, we all know that this kind of work group has talked about racial and geographic equity in service delivery. And so that's pretty much what this particular piece of the infrastructure section talks about. It talks about creating a process for equitable distribution of resources, prioritizing funding to organizations that work with special populations, and also framing as like a whole person care kind of approach that we're taking. It also speaks to supporting system impacted communities through equitable distribution and leveraging additional resources. We spoke again to kind of...
I didn't hear an applause on that, but I heard a lot. Is that good for you guys? Yeah, all right.
Okay, so the next piece is around education and public awareness. We placed this in the infrastructure piece again. I know it's in -1 already, but we wanted to add it here as well. This is again kind of improving the awareness that other types of services exist for alternatives and diversion for system impacted folks. So also we talk about educating law enforcement and community members to understand alternatives to 911. And alternatives to arrest and jail. And it talks a lot about kind of a communications plan that can continue to support messaging and webinars so that people are aware of other types of services that exist. And then here's a lot more for infrastructure. Here we placed data and accountability recommendations. So a lot of the recommendations here are from the Data and Research Ad Hoc Committee. There are also some that came out of the Community-Based System of Care and Justice System Reform Ad Hoc Committees. It speaks to really developing systems that allow folks to understand what types of services are out there, how to utilize those services. It also speaks to providing feedback opportunities so that people could give feedback around the services that their loved ones or themselves are utilizing. And it talks about just tracking incarceration spending, data on services for impacted people again, and pathways out of incarceration. So there's a lot of recommendations there to kind of develop this system so that we have access to this information. And then we have a workforce development section. So this really speaks to expanding and supporting the workforce of system impacted folks. So obviously you all know there are a lot of community health workers and other types of positions that have been leveraged at this point that employ system impacted folks. So this really speaks to providing additional training, increasing the employment opportunities, and hiring more folks and tailoring county contracting incentives to actually hire more system-involved individuals. We also talk here about conducting intensive and extensive outreach to medical professionals. to also support people to come into kind of the health services field and expand that workforce. And then finally, we have organizational capacity building and contracting. So obviously this is something that the community has talked about for a long time. Community-based organizations have needed organizational capacity building support to provide resources and support to system-impacted folks. So this really speaks to all of those things. It talks about leveraging and incubation academies to actually support organizations that are smaller and haven't necessarily been able to contract with the county or receive resources to provide these types of services. It also talks about connecting contractors to existing capacity building resources, since there are some organizational capacity building resources that exist. It speaks to changing contracting processes, so standardizing contracting processes to make it easier for organizations to actually get funding to provide the services that many of them are already providing. Yeah, I think I'll leave it there.
Okay, thank you. So the purpose of this overview is not to give you a test right now so you know every single little recommendation. It's not that. And so if some of you are feeling like, I got lots of questions, that's good to know. But the purpose of this presentation was really to give you an overview of how to read these documents so that you can be able to look at the interim report, look at the table that we sent you. And if you didn't get the table, again, make sure you're on the email list so that it gets to you. So you can see how we can take all of that information and start organizing it into some clear categories. So the purpose really is to help us eventually with the question that you brought up earlier around prioritizing these recommendations. So what I'd like to do, because this is a lot of information, is to give you 5 minutes, either individually at your table, and just see kind of what did you like, but also what questions might you have about what you heard, right? So 5 minutes to just review the stuff and see what kinds of questions you have. And then from 1:25 to 1:40, we're just going to have a conversation here and clarify as much as we can. And at 1:40, we'll stop this process because we still need to give you, I'm sorry, at 2:40. Thank you for pointing out. At 2:40, we'll stop because we still need to have the presentation from the Community Engagement Ad Hoc Committee, all right? So 5 minutes, go for it, talk it.